All right, this is Dr. Cohen. I'm here with Gregory. He had very involved Dupuytrens in both of his hands. And on the right hand, we did surgery back in 2016. Which fingers was that?
It was the ring finger and the middle finger.
Okay, go ahead and make a tight fist for me and straighten out. Good. And do you remember what was your position before surgery?
About 35 degrees, I think it was. Yeah, about 35 degrees, about like that.
Okay, and that was 3 years ago, and knock wood, we've had no sign of any kind of recurrence. And you can see, although the initial incisions look pretty gory and scary, how nicely it heals once it heals up, and it looks great, and he's got great function there. So then, as is typically the case with Dupuytren's, it was in the other hand as well, and he had surgery on the left middle ring and small finger, along with a surprise cyst that was in there. That was back in June of this year, so we're in December now. It's been about 6 months. Go ahead and make a fist on that one. Good, and straighten out. So again, you can see he's healed nicely. No sign of any kind of recurrence. Do you remember the position you were in before that?
This one was worse. It was, especially in the ring finger, it was almost to a 90 degree. So, and not quite as much for the little finger.
Perfect. So nowadays there's a lot of discussion about getting the injection for this called Xiaflex versus doing the surgery. And a lot of people are afraid of doing surgery because of the implications. What was your experience with doing the surgery as opposed to the injections?
I read about the injections, and the surgery was, especially on the right hand, it wasn't as far along as the left hand, but it was just weeks, and I was back in business with the right hand. This one had gone a little bit further, so it's been a little more of a struggle for me. But as far as the surgery, it hurt for about a half a day. I kept it elevated like I was told to do. And I went to physical therapy the day after surgery, and they tuned me up and they got me in a splint that protected it, and they started working on it right away instead of a friend of mine who had it, waited a couple of weeks for physical therapy. And I think getting in early, let's just get on this thing and make it better, and it was very successful.
Right. I believe big time early range of motion and therapy is the key to the successes that we have here. So yeah, you're doing great, and we know from recent studies the chance of a recurrence after surgical intervention is a lot lower than if you use the injectable Xiaflex. And at least in my practice, my patients, my hands, I want surgery, and I'll take a quoted 4% recurrence rate, although in my practice is actually lower than that, over a near 50% recurrence rate with the injectables. So I thank you so much for sharing your story, and continued success with the therapy you're doing. Thank you.
Thank you.
All right.